Is cluster feeding normal for newborns and their sleep schedule? Imagine your newborn suddenly wants to eat every hour or so in the evening. You might wonder if this is normal or if something's wrong. Well, it is actually very common. Cluster feeding is a typical behavior for many babies during their first few weeks. It usually happens in the late afternoon or evening, when babies want to nurse more frequently. This pattern helps babies get enough nutrition and also signals their bodies to produce more milk. Newborns have tiny stomachs, often only about the size of a cherry at birth. Because of this, they need to eat often, sometimes every 2 to 3 hours. During cluster feeding, they might nurse for about 10 to 15 minutes, then take a short break before feeding again. This can go on for a couple of hours, especially in the evening. It can be tiring for parents, but it is a normal part of growth and development. Cluster feeding often happens during growth spurts, which usually occur around 2 to 3 weeks, 3 months, and 6 months of age. These periods are when babies grow rapidly and need extra calories. After a cluster feeding session, many babies will sleep longer stretches. This is because their stomachs are fuller and they feel more satisfied. However, some babies may still wake frequently at night, even after cluster feeding. From a sleep perspective, cluster feeding can be helpful. It can encourage longer sleep periods at night because the baby is well fed and less likely to wake up hungry. But it is not a guarantee. Every baby is different. Some may still wake often for comfort or feeding, even after a long evening of cluster feeding. For mothers who are breastfeeding, this pattern is especially important. It helps increase milk supply because the baby is nursing more often. If a mother worries about her milk supply, frequent nursing during cluster feeding is a good sign that her body is responding well. To manage this busy feeding time, try to rest when your baby does, especially during the evening. Accept help if you can. You can also try combining cluster feeding with techniques like dream feeding, which means feeding your baby while they are still asleep, to help them sleep longer at night. Remember, this phase usually lasts only a few days or weeks and is linked to growth spurts. Trust your baby's hunger cues and avoid forcing feeds if they are not interested. If you are concerned about milk supply, pumping can also help stimulate production without forcing your baby to feed constantly. Overall, cluster feeding is a natural part of caring for a newborn. It supports their growth and helps establish a good feeding routine. While it can be exhausting, understanding that it is temporary can help you feel more confident and less stressed. Just keep in mind that your baby's sleep schedule will gradually settle as they grow and their feeding patterns become more predictable.